Welcome back. I'm Dr. Jim, continuing my COVID-19 series. This one is on skilled nursing care and COVID-19, special issues and challenges, of which there are many. Seniors who reside in skilled nursing centers around the country may have several chronic illnesses and disorders that make them really susceptible to infections, the common cold, flu, and COVID-19. It is now known that older people, 60 plus, are at an increased risk for health complications if they contract the virus. Those who are 80 years of age and older are the most vulnerable for severe health problems, hospitalization, and unfortunately, even death. It is absolutely critical that healthcare professionals take every precaution possible to keep their residents healthy and safe throughout this crisis. Now, what's a special issue in skilled care? Staffing shortages. It's driven me crazy for 30 years, and I've tried to slow it down in certain communities in multiple states. Some care facilities are already experiencing staffing shortages, and if you are, my heart goes out to you. But especially among certain staff, nurses and nursing assistants. These individuals are responsible for providing the majority of hands-on care and assisting with activities of daily living, or ADLs, including grooming, bathing, toileting, and eating. Nursing assistants and nurses provide basic care that's essential to everyday health, well-being, and quality of life. And having a shortage puts greater demand on the staff. Another issue and challenge: sick employees need to stay home. Well, now we're going to work even shorter. Adding to the staffing shortage, if employees develop symptoms of dry cough, fever, shortness of breath, they will be asked to stay home and not come to work. They should be self-quarantining and self-isolating. They may also choose themselves to self-quarantine, taking extra precautions to stay away from others when they have no symptoms. Or they might self-isolate, staying away due to being actively symptomatic themselves. Either self-isolation, self-quarantining, either one of these can make matters worse because you're pulling more staff away from the community and into their homes, making delivering care more difficult. Another issue, another special problem or challenge in senior care: families in distress. Many care communities around the country have decided to either limit visitors or ban it altogether. CMS has banned it. While the top priority is to provide high-quality care to residents, families may be feeling left out, afraid, or concerned about their loved ones. Some care communities are using social media to keep families connected. And there are families, I've seen them online, I think you have too, visiting their loved ones from their window, singing happy birthday in a circle outside of the window. And, you know, it's like bittersweet. It's like, oh, that's so beautiful. Oh, that's so sad at the same time. Another special issue: PPE. Is it running low? Do you have it? Do you have everything you need? Is it being stolen? Is it being sold? Are companies gouging you? Personal protective equipment during flu outbreaks, and especially now, you need more of it, and you're going to be going through more of it more rapidly while vendors are trying to keep up with the demand. And great companies around the country are stopping production on whatever they're making, and they're cranking out face masks and other types of things that they normally would not be making. That is American ingenuity, and I love it. So while vendors are trying to keep up, leadership might have to turn to online retail sources like Amazon or eBay. You just have to be careful about price gouging, which is a criminal act, by the way, during a national crisis. If at all possible, stock up as much PPE as possible for the upcoming weeks and maybe months. Loneliness. Oh, This is a sad one. One very sad outcome of this current outbreak is the isolation and the distance between residents and their family, their friends, and other visitors. How many seniors in skilled care look forward to those visitations from someone on the outside, from their grandchildren, and so on and so forth? Some residents already deal with loneliness, which is associated with poor health and quality of life. Loneliness is not good when we're old. It really takes a toll physically. Some studies suggest that loneliness is a contributing factor to physical health problems, specifically like heart disease and stroke. Psychologically, loneliness can lead to mental health issues, increased stress, anxiety, and depression. So thank God we have technology. Social interaction, on the other hand, can greatly improve emotional and health status, as well as enhance cognitive abilities like memory and attention. Being socially connected has a number of benefits, and nursing facilities will need to do their best to use technology. Look, you have Facebook Live, Instagram, Snapchat, blah, 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 all these things to keep residents and their families and friends in touch with one another. Please get creative. Some of you already are, and I know people are grateful for that. Final thoughts. Today's skilled nursing centers face a wide variety of challenges on a hour-by-hour basis, day-by-day basis. Staffing shortage, high turnover, low margins, intense regulations. That's old news. COVID-19 makes all of these challenges even greater and adds a tremendous amount of pressure to an already stressed industry, senior care. Leadership and their teams will have to come together like never ever before to meet old challenges as well as new ones that will be presented right around the corner as long as this viral outbreak continues. So that's what I have for you today. Skilled nursing care and COVID-19 special issues and challenges. Come back for more. Visit often. My name is Dr. Jim. And please, if you work in a skilled nursing home, do your best, stay vigilant, and remember, no storm has ever lasted forever. This will be over. Take care.